Hi, my name is Heath Rogers, and I'm a student at the BSM program at Northwest Florida State College, and this is my presentation on hand hygiene, um, trying to decipher which is better at stopping the spread of infection using soap and water to wash your hands or just using the alcohol-based hand sanitizers. My PICO question is here, and it's pretty much just saying the same exact thing. It's just saying which one's better at stopping the transmission of infections in the hospital using the hand sanitizers or washing your hands with soap and water. I chose three articles that I thought would help um, decipher between the two, which one was better, and also explain when each one can be used at different situations. The first one I chose was hand washing and surgical hand antisepsis. And it goes on to tell, I didn't know this, but actually, before doctors go into the OR or scrub techs, whoever, when they scrub in, that they can actually use the alcohol-based hand sanitizers now, and is just as effective um, as preventing infection as washing your hands with soap and water, unless their hands are visibly soiled, then they must use soap and water before. The second was hand hygiene, back to the basics of infection control. And surprisingly, it said the same thing. I thought that soap and water would definitely be better at killing everything, but it actually shows that there's a high percentage that alcohol-based sanitizer are actually just as effective or more effective than washing your hands with soap and water. But it did say the same as the other article that soap and water does have to be used if your hands are visibly soiled, or if it's a bacteria containing spores. The alcohol-based sanitizer will not kill the spores, only the soap and water. The third article I chose was effects of student participation in hand hygiene monitoring on knowledge and perception of infection control practices. This one didn't really tell the difference or which one was better, but it actually went into detail and showed that some students went into a hospital and did a study of watching people wash their hands and how often they wash their hands, whether they were doing it before they entered the room or after the room. And I thought this was a good article to show that it just makes us kind of pay attention to make sure that we wash our hands like we should and prevent the spread of infection even farther. And after the study, it actually showed that some of the students actually increased their hand washing and noticed that they should have been actually washing their hands more than they were. So I thought that was good and actually helped me in my job, because now I actually pay attention to others washing their hands, and I actually make sure that I wash my hands more when I'm at work. When sometimes you'll get sidetracked and talking to someone, or somebody will ask you a question and you don't wash your hands while you're entering the room or exiting the room, or even after you taking your gloves off. If you start talking to somebody, you'll just throw them away and then walk off. It makes me pay attention to more and make sure to decrease the spread of infection, especially since I work in the cardiac ICU. When you're dealing with all the patients right out of the OR, you definitely don't want to cause infections or any more problems when they're already having enough problems as it is. And as with the other two, I thought it was very interesting that the alcohol-based rubs and hand sanitizer are actually just as effective or more effective at killing most things, except for, like I said, if your hands are visibly soiled, then you have to use soap and water. It just makes everything a lot faster because they're always on the walls, and you can walk in or on the way in, put some on your hands and wash your hands, and then on the way out, even if somebody's talking to you, you don't have to stop and wash your hands at the sink. And that's pretty much the end of my presentation. It actually, like I said, it did help. In fact, that I can actually use this stuff at work. Here, I'm going to move my camera up so you can see my slides. That's the PICO question, and that's where I actually search for the articles. Then the critiques and then where I can use them at work. And then this is just a picture of actually of all the different bacteria and stuff on your hands that you can be transmitted while you're in the hospital or anywhere, to be a matter of fact, that can be caused, or that can cause infections or just types of viruses or anything like that. But that is the end of my presentation. Thank you.